Corner on BENTV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome back to Health Corner. Today we're talking about hypertension part 2. I'm Dr. Ukpaka. Right. In the first episode, we talked about the common background information, the common knowledge, things you need to know about hypertension. If you remember this chart, I talked about low blood pressure being from anything below 90 systolic and less than 60 diastolic. Now the next one is the ideal blood pressure, which is blood pressure between 90 systolic to 120 and 60 diastolic to 80 diastolic. So you can see the chart. And then the pre-high blood pressure, well, this is the one we call borderline blood pressures. It's between 120 to 140 systolic and 80 to 90 systolic. And anything over 140 is high blood pressure. Remember the severe blood pressure, the severe hypertension, which is 180 over 100. For that, the risk of complication is very high. But just note that if somebody has a high blood pressure, it does affect the organs, and this is the reason why I always ask by everyone to monitor your blood pressure, especially people over 40. But we'll find out that hypertension is actually affecting the younger age. We have people in their 20s who have high blood pressure. We're going to address a different aspect of hypertension. But before we do that, remember the risk factors, which I talked about. There's the genetic one, which is the family one, the ones that run in the family. And then the environmental one. And I did mention that hypertension, 95% of people with hypertension have no cause. These are the essential hypertensives. But before you say that there is no cause, you must have tests done. So we normally advise anyone with high blood pressure to get your blood pressure checked with your doctor. Always go to your doctor and have your blood pressure checked. So if 95% has no cause, that means that 5% has causes. So you find out that without having a good test done, you won't know which category you belong to. We know that majority of people will not find any cause. But apart from that, not just looking for cause. When you go to do a test for a blood pressure, to have a check done, your doctor will also check whether any organs have been affected. It could be the kidneys, it could be the eyes, it could be any other organ. So, hypertension is a very, very important health condition in our communities. But the risk, one runs with hypertension that doesn't have any symptoms. So people can have high blood pressure causing internal problems without any symptoms. So this is why when you are over, an adult age, always get your blood pressure checked, and it doesn't cost anything. Within a few minutes you have your blood pressure. So now I remember I talked about the environmental factors, which I'm going to elaborate more later in the program. So this segment is, what do we do? How do we take care of our blood pressure? If someone has high blood pressure, what are the treatment options? What can you do? The first one is, obviously, we've talked about the risk factors. We're going to address those risk factors. And the first one, what I'm going to talk about here is lifestyle. How do you prevent, if you have the risk of coming out with hypertension, what are the things you can do to minimize that risk? First is salt. I said, eat low salt. Now, how do you eat food low in salt? I've seen some people who, even once you give them food without testing it, they just put salt in it. That is not a good habit, because that type of salt, adding salt to your food, whether it is without testing it, it makes you run the risk of accumulating salt in your body, and which is also a main cause of hypertension. You find out that 75% of the salt we eat, the salt we get in our system is already in the food. So when you are cooking or adding your salt, just be aware, many of the processed food also are high in salt. So the advice is always buy food that is low in salt. The processed food will tell you the amount of sodium, in food. So I'm going to talk about this sodium, because it can be confusing. Everyone will say, "Oh, what is the amount of salt, we are allowed to eat?" Now, you are allowed to eat, or we recommend that you eat less than 6 grams of salt. And what does that mean? That is 1 teaspoon, spoonful of salt. So, 1 teaspoon of salt contains less than 6 grams of salt. That is the recommended salt. Now, there are other things that contain salt which we take without even knowing. Now, if somebody is taking a tablet, some of the effervescent tablets, the ones we dissolve in water, actually contain high level of salt. So if it's possible, to take the tablet, especially people who can take the tablet and who run the risk of having hypertension or who have been diagnosed with hypertension, my advice is take the tablet and probably avoid the effervescent ones, the dissolvables, because especially if you don't know the amount of salt they contain. Some of them have got up to 1 gram of salt, in a tablet. Now, what else do you do? I've talked about adding extra salt when you're cooking, putting salt in your food without testing it. Yes, salt might be good for some people, but it's not always safe to do that. Right. Eat food, fresh food, and fresh vegetables, fresh fruits like celery and tomatoes. They have low salt. We've talked about things that some fresh foods that have low salt content. These are, I call them salt alternatives. Spices like peppers and I'm not going to mention, but some peppers can actually be substituted for salt. So these are all things you can do to reduce the amount of salt you take. Now the next one, I've talked about salt. I'm not going to elaborate more, but in conclusion, in a nutshell, eat less salt if one has the risk of coming down with blood pressure, or if you have hypertension. It's always good to minimize the amount of salt you take. The other is, it's been found that if you drink more than 4 cups of coffee, one tends to have a higher risk of getting high blood pressure, which is hypertension. So, if you're a coffee drinker, try and cut it down. You can cut it down to less than 4 cups a day. People who drink tea, some tea, is good. Some might not be too good for the body. So, I'm not going to talk much about this. But if it's possible, drink more water than these stimulant drinks. Now, smoking and alcohol, we always talk about that. Yeah, smoking, if you smoke, try and stop. Drinking less alcohol is better for the body. Now, obviously, alcohol leads to weight gain in some people. So if you cut down on alcohol, it's good for you. Now, reduce your weight, cut down on, because that reduces the load of the heart in pumping blood. Keep active. About 30 minutes walk is good for blood circulation and is good for the heart. Shop less for food that is low in sugar. Also remember to shop for the ones that are low in fat as well as in carbohydrates. If possible, make your own food. Home cooked food is probably better And well, we always say it's better than the processed one because, the one you make yourself, you have more control than the one you buy from the shops. So this is the end of the first segment. Stay tuned. We'll be back, to talk more about hypertension in the next second segment after this break.
Health Corner on BENTV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries for the educative and innovative medical show by Crystal Life.
Welcome back to the second segment of Hypertension Part 2. Yes, I've talked in detail about the modifiable factors, the lifestyle factors, which we can control without medication. But what if you do all this and you are not able to control your blood pressure? And your doctor will, will advise you to go on medications. There are different medications we take for blood pressure. We're not going to call particular medications, but there's what we call stepped care, where we have step 1, step 2, step 3, step 4. But these classifications are not; these are just generic, and it's also to make it easy for people to understand what I'm talking about. Now, step 1 is for people who are less than 55 years old and you are Caucasian. There are drugs, medications that your doctor will give you. One of the medications, has the side effect of causing dry cough. If that happens, your doctor might change you to a different one, which is in similar group. But for the black and ethnic minorities, there's a different one the doctor gives. It's good for the black and ethnic minority of any age, and also it's good for the Caucasian who are over 55 years old. So, their doctor will explain that in details. And what if this step 1 does not work? Their doctor might want to add a different tablet, sometimes a water tablet, to the step 2. Remember, step 1 is the basic blood pressure treatment with one drug or the other. But step 2 is where it's adding another medication to step 1. So your doctor in step 2 might want to add, something like a water tablet, but he will discuss that with you. In step 3, the person needs maybe more than just 2 medications. So for that means that your blood pressure is still not controlled with 2 tablets in step 2. So you might need to add a third one. Now, what if the step 3 blood pressure control is not adequate and the person's blood pressure is still high? The doctor can still do something about it, because what you do, he might optimize, what we call optimize, give you the optimum doses of all the medication in step 3, or he might need to add one more tablet to step 4. And in step 4, if it's not being controlled, your doctor, your general practitioner may decide to refer you to a specialist, a cardiologist. Now, he knows what to do. But you cannot treat hypertension by yourself. It's always good, to do that under supervision of a doctor until your blood pressure is stable. Then, you find out the right medication for yourself that controls your blood pressure. But remember, if you're taking medications, always do your blood pressure at least once a year to make sure that the medication is working, because blood pressure, can change. For the medication, some people might take one medication today, and then, a year or 2 years after, they might want to have another one, or add another one to the one they are taking. There's something your doctor will also do, risk factors, risk of getting stroke. We call it 10-year risk assessment. This does not work under people who are 40 years old, but that will also guide your doctor in the treatment, because there's something we call the Q risk, or the Framingham risk of coming down with either stroke or heart attack. These are all things your doctor will take into consideration when treating hypertension. Remember, if one has a blood pressure problem and diabetes, the treatment will be a bit more aggressive. So, and we know that hypertension can predispose. That is, hypertension can make someone come down with diabetes, especially if it's not well controlled. So always listen to your doctor and look after yourself. So hypertension has complications, obviously. Remember I said that it does not give any symptoms, but sometimes by the time it starts giving symptoms, it's too late, especially if it's affected organs. Now, the commonest one everyone knows is stroke. If somebody who has high blood pressure that is not controlled has 7 times risk of coming down with a stroke, and then 3 times higher risk of coming down with a heart attack. Now, you remember when I said systolic blood pressure is when the heart contracts. If somebody has hypertension and is not treating it, what happens? The heart is working against more work. That is giving more load to the heart. Also more load when somebody is adding weight. So, and for that, it's just like the heart is in the gym. So when the heart is working that way, what happens? Well, the muscles of the heart might get bigger and thicken, and that's called, ventricular hypertrophy. So it's also a complication of hypertension, especially the ones that are not, well treated. Now we're talking about, the heart working against more work. At some point, if this blood pressure continues to give more workload to the heart might, fail to compensate, to cope with this workload. And this is where we talk about heart failure. So high blood pressure can lead to heart failure. And somebody with high blood pressure has 6 times a higher risk of coming down with heart failure. Now, hypertension does affect blood vessels, especially the small ones. And, we've seen cases where, it leads to blindness because of the blood vessels in the eyes being affected. And remember, stroke is more of blood vessels in the brain, either popping or being affected by high blood pressure. So high blood pressure does not come without complications. And it is very imperative that we look after our blood pressure. In as much as it's a very common condition and people, do go about their normal business, with high blood pressure, if it is not well controlled, if you don't look after yourself, it can lead to complications. And the complications might be too late, to reverse. So, in general, and blood pressures are very common. It can run in family, but there are other causes as well. We can do something about the other causes, which is like our lifestyle, obviously. Look after your weight. Look after the things we put in our mouth. Low salt. I know that some people talk about calcium, but I'm not going to mention that. Drink less stimulant drinks that raise your one's blood pressure. If you can drink less than 4 cups of coffee a day, that is advised. Remember, these are all risk factors. It doesn't mean that everyone who drinks more than 4 cups of coffee will come down with hypertension. But remember, there are other causes. It's not just one particular thing. Also, always exercise, because by exercising, you're helping the blood to circulate better. Don't stay in one place. And physical inactivity obviously makes one eat more, makes one add more weight, and then also can lead to rise in our blood pressure. Now, always remember this chart. This chart is a very good guide. You can find it on the internet. You can find it on our website. This explains the different levels of blood pressures. But it does not answer what to do to prevent you coming down from blood pressure. If you have any questions regarding hypertension, look at our number. We are very happy to answer your questions. We have a text. Send us a text or WhatsApp. Send us email. Look at our website. We're very happy to answer your questions. And we're looking for sponsors. Health Corner would like to partner with any sponsor that wants to associate with us, to bring even more health information and health news, and then also to empower everyone, to look after his or her health.